So today we have Sue Smith with us, who is based in the world, and Sue is trained as a GP and until recently worked within a GP practice. She has been the recent regional director of the British Lifestyle Medicine. She runs a company that does wellness life coaching, as well as the director of Flourish, which is a lifestyle center, if I've got that correct, Sue?
Yeah, lifestyle medicine clinic, I think we're calling it, Flourish for Life. Yep.
And today we are going to talk about the other hat that you wear, which I believe is very dear to your heart, because it's actually on your chest.
It is. I'm going to share it there.
Yeah, it's Walk with a Doc.
It's a hoodie that I wear. I do have a hat that I can wear as well, but I wear physically. But I have the hoodie on today.
Yeah.
Because it's the day I do it, actually, that recording on a day that I do Walk with the Doc. Yeah.
Fantastic.
It's Walk with a Doc, as in doctor.
Yes.
Although I do take my dog, as you know.
Yeah, I know.
As well. Being the doc.
That was something that really inspired me to be lucky enough to come and meet you in the place, doing the stuff that you love doing. And that's why I wanted to see if we can share what that journey is like been for you, and what the story entails, and how you've gone from that. So Sue, it's been great seeing you today. Right. It is great seeing you today. Maybe you can start by telling us something, fill in a bit more of the gaps.
The gaps, well, a big story, but I mean, I suppose just going back with Walk with the Doc, we focus on that. I guess that is, in lots of ways, it's a demonstration of where I am, I guess, where I am at the moment, because it represents so many different things. And I think we talked about that on the walk, didn't we? What Walk with the Doc has in terms of its potential. But I heard about Walk with the Doc when I was doing the qualification for the British for lifestyle medicine, to become a diplomat there, to do the diploma. And I picked it up and I thought, oh, that looks really interesting. And I pretty much picked it up and ran with it straight off. That was in 2018. And just going back a little bit in time, you know, as to why I was doing the diploma in lifestyle medicine. I've been, like, I've mentioned, a GP for 20 odd years. And previous to that, I was in hospital medicine. And in roughly around 10 years ago, got more fascinated. Like, you know, GP allows you to do this in lots of ways, primary care, with behavioural change and behaviour. And I qualified in various things that pretty much led me to be a coach, health and wellness, coming through the door of health and wellness as a coach. And lifestyle medicine I was introduced to in 2017-18, and found out more about it, and found out about the British Society, and it just resonated with so many of the messages that I was already standing for and what I wanted to stand for, that I ended up doing that diploma. And in that diploma I found Walk with the Doc. And what I found out about Walk with the Doc is that it was set up by Dr Sabgir in 2005. So it's actually 17 years old now.
Wow.
And he was a cardiologist. And I think we both relate. I've heard a lot of what you've got to say around this kind of arena, but he was just frustrated. He was frustrated as a cardiologist around kind of motivation of his clients that were very sedentary in the lifestyles that they were leading, to get them up and moving more, because we know it makes a difference. And so he wanted to kind of create that arm, I guess, to his clinical role, and invited clients that he had to walk with him in a local park. And he told a whole load of them, and over 100 attended the first time, which is pretty amazing. And since that time, 500, they call them chapters, but other doctors leading walks have been established worldwide. So a lot of them in America, but they're all over the place. So it's worth having a look.
Yeah.
And I'm just going to quote what he said on one of the walks to the people that were stood there. And I know that you might relate to this. I certainly did. I want to talk about how easy taking care of ourselves can be.
Yeah.
And it, you know, I think when we deal with disease so much in primary care or in healthcare, really, it can become unclear how easy it could be. And I think that ease about health is really important, and that was a lot of it. And the mission is about inspiring community through movement and conversation. That's their mission, to inspire community through movement and conversation. And all of it just starts with that first step, which really resonates with a lot of the BSLM message of what #1 change. And why would we do this? You know, as he quoted, 80% of cardiac disease is preventable with just going for a walk. You know, just doing that one thing repetitively can make such a big difference to your health. And the main message was that we as doctors go that extra mile with them. And I think that's where I've really experienced myself the benefits of running the group. So there's benefits, obviously. I wish to have benefit to people joining, but I do, and I think, you know, I think we can talk about that more. But benefited myself, seeing it almost from the perspective of the person walking with me. And there was a lovely, you know, on the website, the Walk with the Doc website, you can find that. There's one person that, you know, quotes that, you know, if people just take that first step, they will never look back. And I think that is, it's just encouraging people to take that first step within a community that is there for them, but they can talk with others. That's essentially it. I mean, I think that's where the magic happens. My personal experience has been that since 2018, I was running them very small groups. And then in 2019, for many reasons, I took my foot off the pedal. There was lots of other things going on in my own life. And then in 2020, what happened to me was I decided to go, I had a Facebook group that we have, all the chapters of the Facebook group, that I decided to do live walks. Just went walking with the camera in my hand, encouraging people just to walk, you know, and you know, we all knew how difficult lockdown was, and I was trying to aim to talk about subjects around the benefits of walking. And on Walk with the Doc, we have it's called the 100 Reasons to Walk. You know, there's a list of really good reasons why we walk for health, and it's not just about fitness or even cardiac health. It's a lot more why and how, the science, I guess, behind the benefits of walking. And so I used to do that subjects. You know, it could be, I don't know, how it helps strengthen your muscles, or how it helps you maintain your weight, or how it helps with your mental health, or how it helps reduce anxiety, or, you know, what is it that specifically, and the reasons behind why. And that went on over 2020. And I started the group up in person as soon as we could, really, and then it kind of grew from there. In 2020, I was lucky enough, 2021 actually, last year, lucky enough to be picked up and ended up on the BBC News, leading the way. And it's just so good to, you know, something such as simple to actually get that message across in that way. And then the park we walk in has been very instrumental as well, which I think really encapsulate that kind of community aspect of it. So I discovered through someone we met at the park that there was friends of the park, and she said, oh, you should have a look at that. And I did, and there were some beautiful photos and lovely community feeling within the friends of the park. We walk in Birkenhead Park on the Wirral, and so I joined it and I was accepted, and then I just posted, you know, I love this group, I love the photos in the park, and I do a walk. and it's just grown and grown and grown since then. I've had some great people joining. So we go once a week. It's an hour. I get there a bit early.
Can I just pause you a minute, Sue? Sorry,
Yeah,
I didn't want to lose this piece that you mentioned early on. I think, which is really important from a broad medical perspective, is that how easy it is. That piece is so important, because I think for medics, because I don't know about you, because I spent my life doing hospital medicine, and it tends to focus down on, well, the hand or the eye or the foot. Sorry, the foot's down there, or the head, or the heart, and we start to drill down into an organ. Or tell me about your blood sugar, and then we'll work on your blood sugar, and it's very, very bitty. It's like, hold on, where's the person in all of this? And so that's the one piece that because it's so fragmented, it's really hard, I think, for people. And even I think sometimes maybe we should stop using the word patient. Find a different way of being with people, to say, okay, yeah, here's what you can do. And it is as simple as going for a walk.
Honestly, I couldn't agree more. And I think this is the message is so fundamental and so simple, and yet at the same time so profound, because what I've witnessed and what I've experienced is I guess lifestyle medicine in practice. That's what I mean about representing where I am right now, because although it's just a walk, it's far, far more than that, and it's such a simple and easy thing to do, and yet it's far, far reaching. And so you're right, it brings all these silos, if you want, of health and complexity, and also it creates this kind of awareness for the people that arrive at the walk, that they are actually able to create their health destiny in that way. They're able to say, yeah, I get, I have a foot and a hand and a blood sugar and a this and a that, but actually I'm going for a walk, and that's creating one walk at a time, the destiny of where I want to take my health. And I think I'm sure people listening, most of us are very blessed to be able to walk, and obviously the walk with the doc actually welcome anyone, any ability, not just people that are physically walking, come in any wheelchair or whatever. It's just people getting outside, also being part of the community. But it is this kind of multi-layered kind of medicine that walking can possibly be, that has fascinated me since starting it. I mean, I walked before, but I don't think I'd really, until you start experiencing how it's experienced by others, can you really understand the power of it. And I feel very, I've been very inspired by the people that join, and obviously I always aim to inspire the people that are there in some shape or form. So it's a lovely melting pot, if you want, like you say, bringing all those bits and pieces kind of together.
On that note, I do remember when I came on that walk with you guys, it was a lady who was the slowest walker, and she walked with a stick, and it's not like everybody is like like this walking along, so it moves back and forth, and that sort of flow is really important, that you don't feel, or I imagine she doesn't feel, that I'm slowing everybody down, and neither do I have to keep up with everybody. which is kind of mirrors what I think when I go on a park run sometimes. I think, oh, well, I know there's somebody at the end who will go, yeah, Johnson, you got there. And the guy's going,
So important.
and it's like, hold on, my personal best, and they'd be looking at it and say, oh, 17 minutes, 15 minutes. I'm thinking, good for you. But there's still a community spirit in there, because the same guys who went past me and have done their whatever they've done are the ones who are walking back towards me going, go on, you can do it. You can do it. And that I think is common, there's a sense of camaraderie, a sense of community, a sense of belonging that is maybe only, that amount for the whole week, but it means something and it's special.
Oh goodness, yeah. And we've used the environment, and I think when the focus is not on the walking as such, so like you say with the park run, it's not on the running, it's on the actual experience of running. I've really aimed to make it clear that the essence of it is not on the walking, although we may in time as we get more people have faster walkers and slower walkers and whatever. That's not really necessary. There is about, we will all mix and match, so people will stroll, like you say, with slower walkers, or maybe go up ahead and then walk back.
Yep.
I think you knew when we were there, a couple of the people, I give them litter pickers, so we allocate, so that's obviously that's slowing people down, so I tend to keep the faster ones doing something for the park. And that's been an incredible thing. I wasn't expecting that to work in that way. It was like kind of a let's just do something when we're doing it, because I went around the first time, I was like, oh goodness, there's so much litter, so let's just get doing that. So that's been a really lovely thing, but it also kind of creates this kind of bit of fun and game, really, who can collect the most and who can get there first, and all this kind of silly stuff going on. And I think that sense of kind of moving and communication or conversation, that initial mission really kind of resonated with me. That it's the conversation and the moving, and I think it's the moving is where it's not like all about exercise. It's about the moving, and that's what it's about. And yeah, you're right. It was a good example, I think, the one you came with us to, of what it would be like. There's less numbers then, but it was a really good example of
that I think that I don't know if any other groups would do that, but it's really that in modern terms that the kids, well, I say kids, I have to be careful. The ones who are under 35 tell me it's all about gamification. I'm thinking, gamification. Okay, that's a new word for me. But if litter picking could be gamification, and it brings smiles and all the rest of that, and it builds. Absolutely. Hey, let's go for it.
It is definitely, yeah. And people like it of all ages. So we've had a bit of a giggle, and of course. Yeah. The benefits to people I've seen within the week, so people have come for many reasons, connection, community, needing just to have a reason to get out of bed, so mental health, huge. But what we've also done is use the space between the walks, not just the walks, so use the space between the walks to create an element of accountability. So one particular chap, he really wanted to strengthen up. Well, he didn't actually say I want to strengthen up, to be honest, but there was you could with a discussion and a conversation, he had been very sporty in his lifetime, and that was gone. There was reasons why that was kind of not there. Yep. So kind of plugging that back into his life with like, let's do this distance, let's do this pace, let's do this time between now and next time. Let's bring some interval walking and a bit more hill walking, and he just, for him, that meant a lot. So not everyone wants that, but it could be, let's get out for 5 minutes, let's just get some sunshine on our face, and let's get the vitamin D going, and so on. There's simple things, but so we've used space between for creating meaningful outcomes for each person, whatever that might be. And then I just want to build on that, really, to try and, I suppose, individualize that for different people. And today was interesting because it was the first of the year. So we have been interacting today, both in the group when we were walking, but afterwards we have a WhatsApp group that allows us to chat what our intentions could be and how to modify them to make the best outcome. So it's going to be interesting going forward as well with this group this year too.
Yeah, I like that. Yeah, I love that concept of future thinking and moving forward, because everybody has got some kind of health, serious or less serious, that may hold you back. But when you talk about, okay, so you may have been this in the past, but let's see from where you are now and what do you want to do, and if it's or if there's hill walking or it's whatever else it is, then to have that group of people either pushing you from behind or encouraging you, going, yeah, you can do this, and when you do, can you share it with us? That's fantastic.
I mean, it makes you, it's quite emotional, really, when you get that interaction, when you can hear people talking. So one of the women I was walking on the way out today, and she said, "Oh, actually, I'm going to walk a bit more, and we've already done. I think we've done. Someone had measured the steps, so her intention was the 10,000 steps. She said, I've just been told, someone's just told me we've done 5,000 steps. I said, that's amazing. She said, I'm halfway there today. And I want to build up to doing this particular walk on the Wirral, which is a lovely walk. And there's a kind of thing that someone runs it each year. And I said, that'd be really good for us as a group, walk with a dog. Why don't we do it as a challenge? Let's find this kind of, I suppose, a kind of joint goal, if you want, a joint intention. So we can be talking about that, kind of incentives to, and not everyone will want to do that, but some people might want to jump on it. So it's almost moving along, but it's coming from them, which is what I love, actually getting those ideas. You think, wow, it's such a good idea. And it's just being open to not always having to have the answers, and being open to move with them, and I think that's the important thing. And like you say, going forward, that anything's possible repetition. And I think I really want to kind of build that kind of that belief and that positivity, that positive thinking, potential thinking, and thinking of their personal potential by just doing it often. Because we know, don't we, that like things done frequently over time improve our health, and that's the message. And we had loads of conversations today about that. It's really good conversations about setting goals and how they can be very well. You set a goal and then you fail and then you don't want to do it at all, and it's like, actually, let's talk about habits next time and talk about where the habit fits in, because habit will help you reach your goal. And that's the goal. Needs to be the habit, not the goal needs to be the goal. The goal needs to be the habit. Let's get habit as a goal. So it's
very good.
It's a good space.
I know, just on the back of the community and helping each other, one of the things that someone said to me recently in terms of setting goals is, let's have a community goal, but not in a sense of let's all walk whatever it is, 5K or 4K or 100 miles or whatever it is, but let's say it was 20K, and they say, okay, well, there's 5 of us in this group. Who thinks they can walk whatever the distance is? I say, okay, well, I can do 10. And somebody said, well, I can do 2. And so you build it all up, where each person commits to a particular goal, and then the whole goal is totted up, and then let's see what comes out at the end. And I thought, oh, that's a fascinating way of doing it, because
brilliant. No, actually, that's exactly what Walk with the Doc did last year, and they did a
really,
Grand Canyon, something like Walk to the Grand Canyon or something.
wow,
And there was like 70 miles or something we had,
yeah,
people had to do as a team, but every mile counted. So some people might only put a mile in, some people might do 20.
yeah,
But actually the goal was won by the actual award to, I can't remember what it was called, but something to do with the Grand Canyon. So but I think it's a great idea, isn't it? Because
yeah,
then everyone's donations of equal value in
yes,
terms of, it all counts. It all
yeah,
counts. So it's a great idea. So I'm looking at all those things. So yeah, good one to remind me of, actually. Might well do that. Because I think that people, like you say, it's actually reminding ourselves that it is about the community, and it is about inclusivity and allowing everyone to be there. So it's not about building someone up or building the group up to all walk up Mount Everest or something. That's not what it's about. It's about helping people be at their own personal best, and you know, pushing that along, really.
yeah.
So
I wanted to touch on the benefit bit, because one of the things that really struck me was the benefit of the person who organizes this stuff, because you know, coming back to this, like, oh yeah, so the doctor's doing this for me approach versus we are doing this together. And I was so blessed when we talked about it. Each person has value within that group, and you said to, I believe it was Helen, who was sitting next to you, can I show them what you just gave me? And so could you show us all what you got that day and what it meant?
Yeah. Yeah, well, Helen has okayed it, by the way, that we can share this, literally. So thank you, Helen. And yeah, she turned up. I think it was like that day, wasn't it? And she said, I've done something for you, Sue. It's not much, but it's I've done it for you. And I'm thinking, oh, what's this going to be? This is lovely. And as people know, I have a dog, which I'll just share as well as part of the story. There he is. He comes along with the dog. Yeah. He's not very interested right now. And she presented me with this lovely painting. So she'd done this painting and she said, oh, that's not much. It's, you know, it's just colour my numbers or whatever. But what a wonderful picture and what a lovely thing to be given. And I wasn't expecting that at all. It's just so sweet because the face is very, very reminiscent of Eddie, the dog. And yeah, you're absolutely right. I mean, why did I start it? I started it because it kind of struck a chord that this was something that was, you know, potentially really important. I think that the walk itself, and I had my ups and downs, and somehow I just didn't really let go of it. I wanted to carry on. It was almost just slowly building up, and then absolutely you gain yourself. I mean, I think when you've got that kind of I think you get a sudden awareness, really, be sudden, might be slow, I don't know, that actually this approach of dealing with elements of conditions and diseases and health challenges or whatever, all those things us doctors see, yeah. From this door, going through a different door into this space of using lifestyle as a medicine, that I knew I wanted to do that, but what I suppose, and I was doing it very much kind of because I believed in that process. But what I hadn't really expected, I knew I was doing it for me up to a point, because I think that, you know, hand on heart, you know, we do a lot of the stuff that we do is making us feel good. I mean, I don't think we're going to be pursuing something relentlessly if it's making us feel bad or we're not totally gaining from it. I think we can get into a negative spiral of saying yes to things, and we're thinking, what on earth am I doing this for? And you know, I won't go into that now, but you can end up in this spiral of give and yes and you're not serving your higher self at all. But when you start to say yes to something that you really believe in, and then it starts and it feels good, it feels right somehow, and then you start to use that space, because I use that space now intentionally just to be present and to be listening and to be understanding, because I have a fascination in this arena, I guess, of supporting and helping and inspiring change for the better, and to help people do that. I also have experienced those kind of feelings of personal change myself. And so, you know, when you get something like that gift, then you know, it's almost, yeah, it's a symbol of that, really, that this is really, you know, someone's actually bothered to do it, to put it in a bag, to give it to me. And what that stands for is yeah, you know, it's in the representation, isn't it? That it makes you want to, I suppose it's when you get up in the morning and go for the walk.
Yeah.
You know, it's a good space to be in, and I'm very, very grateful for them all being there and turning up and adding their bit. And you know, so if you're listening, then thank you very much for being there. Very much.
So I'm going to ask you, can you tell me what's the difference between the what you get from Walk with a Doc and your other sort of roles in the wellness space? Can you see a difference for yourself personally?
Yeah, well, I suppose for me, yeah, I think obviously Walk with a Doc, I do. It's not a paid thing. People come along. It's voluntary, and it has been from the way it started from the beginning. I think it needs to be, and I see it very much as my I suppose my donation, if you want, as a doctor. And I think it so much comes back, you know, going that extra mile with them, comment that Dr. Sabgir mentioned, is going that extra mile, that has not only benefited me, but I can see there's loads of evidence of using the doctor as a tool for wellness, you know, actually using that. So I see myself in that hat. I see myself as proactively being present and delivering lifestyle as medicine in that setting, very intentional. So when I'm talking to people, interacting with them, getting people to interact with each other, I've got my medical kind of antennae on, if you want, all the time. You know, how are people interacting? How can they benefit from this group? And how can I help them benefit most from this experience? So that Walk with a Doc is a way of delivering that for me. In terms of my other roles, obviously they are businesses, so it's how I earn my living, if you want. So my coaching business I run, it's me that coaches people, and I do that as a one-to-one. I am thinking of, you know, reaching out more into group settings. It's something quite exciting for this year, to start those kind of things, where people can access me and yeah, have me as a coach. So that's more, I suppose, bespoke and them, and they're more of an interaction of my business with them. And then the Flourish for Life is a clinic that is running very much with the banner of lifestyle medicine, you know, bringing that to the table with clients or patients, calling them patients, because it's actually dealing with where they're at with their health and wellness, both physical, mental, and to use what we know is very good medicine in that space, for them to go away with that as a prescription for them to then put into practice. And part of that offering, there's an element of coaching in that, because it's very much part of that medicine that involves some behavioural change, very much about behavioural change. So that I've set up with another team, part of a team that run that part. So my role in that is very much, I do the clinics, but I also help run the kind of concept behind it as well. So
So would
They're
it?
all kind of part of the same puzzle, shall we say?
Yeah,
They're all part.
they're all different pieces that come
They're
in.
all different pieces. Yeah.
Would it be right in saying that this walk with a doc is the only piece that involves being outside in nature?
Oh, well, maybe not completely.
Maybe not. Okay.
Because I have been known more than once, many times more than once, is to do coaching outside on walks. So I will often, you know, give that as an option to coach people. Not so much since the pandemic kicked in, to be honest, but I used to do lots actually. You know, offer that as, you know, we'd start off somewhere in a place that was dry, but we could sit down, talk, and then go away, and then maybe come back, so we could then write down things and finish off the session. So walking was very much, can be part of what I do. Yeah. I absolutely love that, because neurologically, the way our brain and getting our voice going and saying how we feel, walking and moving is so useful for that when we're a little bit stuck. So I use the body, if you want, to kind of get that conversation going, and I found that a very useful tool. So no, that I would say that, but the rest of it, yeah, not moving, not walking. The rest of it, we're kind of either sat or stood at a desk. I do online mainly coaching now, but you know, I will always say yes to someone who wants to do walking coaching.
No, I know. Certainly, it's that duality of separating mind and body, and the movement is like, okay, that happens down here, but let's do some talking about whatever we're talking about, and we'll just use this half or this small portion and ignore the rest of it, which comes at its own detriment. And I think that's definitely part of the medical ideology. And I'm just really glad that you, in what you do at Walk with the Doc, have bridged that. Just as we're coming towards the end.
Just get involved. Just wait a minute. Go on. Excuse me. He gets involved with the bin, husband doing the bins, and anyway.
He knew it was time to say, it's time you stopped as well.
Yeah, possibly, yeah.
I just wanted to ask you, in terms of other people who might be interested in setting this up. Do you have to be a doctor, or can you be involved in a practice in a other way?
No, well, actually, medical training is some type is useful. They do like the doctors leading it, but you can actually apply with other medical experiences. I think because to run a walk, you need to be, I suppose, have your competencies there, like things like basic stuff like CPR or safeguarding, all those kind of things that almost come with our package as a doctor. But they and also the message, the medicine, the message is from a doctor to people, but I do know some people are doing it from other medical specialties, if you want, or medical specialties, whether it be like physio or nutrition or something like that. So I think it's a matter of people getting in touch with the Walk with a Doc. It's walkwithadoc.org, and you can contact them. Obviously, people can contact me, and I can put you directly in touch with the people who have been absolutely brilliant, helping me, you know, supporting me and setting me up over the years. So I think there's lots of walks out there, aren't there? There's lots of health walks and walks, and I guess this is a space where it very much is a medical person being present that is part of the package, almost part of what the message is.
But like it or not, there is some, for want of a better word, authority or some sense of, this person has knowledge that they bring with them,
Yes, and I think that's
And
not
there's
a
value
bad
in
thing.
that.
And I think in that setting, it's a good thing.
Yeah.
And obviously it puts us, you know, it does put you on the back foot. You're not in your consultation room. Haven't got a prescription pad next to you. You're out in the open. You've got to, you know, you've got to get your feet dirty as well. You know, there's a lot of kind of coming off your horse a little bit as a medic. And being real, being authentic. But yeah, we do have knowledge. I don't think we can really, you know, come away from that. We have knowledge that is useful to impart. And obviously part of the story, part of the agreement almost, that is said is that we're not working there, we're not walking there to become second opinions or medical diagnostic situations. You know, we would be always pushing people back to their doctors or their specialists. We're there to impart our knowledge and our understanding and to keep a safe space for people. And, you know, we can give our advice, but that's as far as that goes. But yeah, we do have knowledge, don't we, Johnson? We do, and we've had it for many years, and it's lovely to be able to package it up in those little. We do a 5 to 15 minute health talk at the beginning. I actually do a bit of a merging of health and behavioural change and talk at the beginning of the walk. We all stand around, have a bit of a chat, and then we go for a walk, and then it all becomes very much about whatever people want to talk about, really. Yeah, and then that I think partly it's acknowledging we do have that knowledge to ourselves, and that we can in that space be okay using it. Because I have had people saying, well, don't they just ask you this and that and the other? Well, no, they might do, but I can then say this is not.
Yes, this is
yeah. I would recommend, you know, A, B, and C or whatever, and that's fine. It's been received with no problem at all. So I think it's about being visible and taking those steps with them. That is the power of it, and imparting our bits and bobs of knowledge, and we can hear their bits and bobs of knowledge.
And that's important as well, that everybody contributes. So just as we come to the end, where do people find you on the online space? Or how do they connect you?
Well, I'm in the usual social media space, on Instagram and on Facebook and LinkedIn. My website's my name, drsuesmith.com. So you can find me there, and people can make contact with me there. And yeah, the other space is pretty much under my name.
Excellent. Well, we'll put those links up attached to this as well.
Yeah.
So it's been a real pleasure talking to you today.
Oh, well, Johnson, you know, I really appreciate it. I just loved having you there for the walk. It was just great addition, and meeting your daughter, and just the whole kind of,
yes,
you know, getting down and dirty and, you know, real. It's just great. Yeah, it's brilliant to be able to, and obviously anyone that wants to come and have a walk with us, they're very welcome.
Yeah. Okay.
Yeah, thank you.
So it's been great. We will see you in the off.
Yes. Thank you so much. Really, really appreciate it.